And we're going to talk about a sector that has been very, very important in the past months. We're going to talk about innovation in the health sector. We're going to hear from José María Romero Fidalgo from the Galician Health Knowledge Agency. We're going to talk about a pilot action going on in their region, something inspired by the Titan project, but I will let José María tell you more about it. I can already see that you're with us. If you can hear us, José María, the floor is yours.
Thank you very much, Mia. Yes, I will share my screen. Well, thank you very much to give us the opportunity to present our pilot action in the Ourense Health Living Lab. And thank you very much for the audience to hear our project. Well, let me start by the very beginning about the Titan project. Titan project is a consortium of 7 European regions, Basque Country in Spain, Lombardy in Italy, Lower Silesia in Poland, Saxony in Germany, and the city of Almere in the Netherlands, and Scotland in the UK. And what we aim is to tackle the challenge of active and healthy aging by improving the quality and performance of the European health regional systems. So, well, in this project, we are already in phase 2, where we have to implement our action plans. I should mention that the learning exchange of this project was very well performed, with more than 50 good practices identified, divided in 3 thematic areas. We have held 6 workshops and 25 policy analysis of the good practices with in-situ visits. As I mentioned before, 7 plans, they were implemented between the consortium, that they were based on 12 Titan good practices with 4 policy changes. But let's mention about, in our case, the pilot action. Well, 2 years ago, we were awarded by the Interreg Europe with a pilot action that aims to test the Living Lab model in the health field before the implementation in the Galician health system. We were very happy to get the pilot action because we really think that we had the best scenario to test the Living Lab model in Galicia. We have the University Hospital Complex of Ourense, and we have to mention that Ourense is a province that reflects what will be the European population in year 2050. Here you can see some pictures of the experimental rooms that we have there in the hospital of Ourense. As you can see, we have all kinds of medical devices and innovative solutions to test new ideas for the elderly population. But what was the inspiration and the connection between the Titan project and our pilot action? Well, thanks to the Titan project, we have identified 4 good practices from Scotland, Basque Country, and also from the city of Almere. 2 of these good practices were in Osasun from our colleagues from BOF in Basque Country, with their in Osasun program, that they inspire us to the drafting of the specific terms of our public call, and also it helped us to write our application forms for the pilot action at the Living Lab in Ourense. On the other hand, we had some kind of inspirations and some ideas of inspiration, such as that the elderly people should be or must be involved in the evaluation of the technologies, and the idea of empowering the elderly people to improve their health, thanks to the Living Lab program that it is developed by our colleagues from the Digital Health and Care Institute. And as I mentioned before, the 2 other good practices that were a source of inspiration to develop the pilot action in Ourense and in Galicia were one from Almere, from our colleagues from Health Factory, that they have an initiative which fostered the collaboration and innovation, bringing together health and care providers, citizens, entrepreneurs, researchers, and the public administration. It gives us the idea of their government model and also their business case. And also it helps us to inspire our specific terms as regards to their service offered. And last but not least, our colleagues from Scotland, from the Chief Tech Innovation Flow, they gave us some inspiration, such as their idea of the minimum viable product, also to develop a demo day, and also their application forms and terms of conditions. So, what we have developed right now in Galicia? Well, we have developed the Galician network of health living labs, called Lab Saúde by their acronym. The idea is to test, and we are already testing the living lab model in Ourense, but to spread to all the Galician health areas. We have to mention, as you can see here in the map, that Galicia is divided in 7 health areas. Each of them is one of the main cities of our regions. And the network of the Galician public health system is composed by 14 hospitals, 500 primary care centers, and more than 36,000 healthcare professionals, also with researchers network. So, as you can see, each facility, each hospital, and each primary care center, we think that could be potential a living lab where companies and researchers and citizens as well can test innovative solutions, mainly focusing on the elderly population. What is our model? The quadricular helix. As in the open innovation model, we think that citizens and patients must be involved. Of course, businesses and the industry in general, businesses and clusters, the public administration, that in our case is the Galician Health Ministry, and as well as the academia, with researchers and also involving universities. How did we articulate it? Well, we are a public administration, so we have developed a public call that is already launched, and it's a public call for companies and also for research institutes that are around 6 innovation lines. Here you can see an overview of the 6 innovation lines that, as you can see, they are mainly focused on the elderly population, with innovation lines such as patient empowerment, the impact of the environment of the hospital stay, patients over 65 and chronically ill as well. But we didn't forget ICTs and robotics and virtual reality, and we let open for new ideas such as biosecurity, new materials, food, textiles, or other ideas. So, the living lab model, Lab Saúde, and our pilot action in this kind of COVID-19 crisis. Well, we have to think that right now, due to the COVID-19 crisis, it's very important to avoid investment in risk. So this kind of living lab model and the idea of testing the innovative solutions before going to the market, it's a good idea, especially if a company or a research institute aims to avoid investment in risk. On the other hand, we wanted, especially now, to launch this idea because we want to support companies that may innovate in the health sector. We have to think that the COVID-19 crisis show the importance of the health sector, especially also for companies and for businesses. And what we aim also to do, to eliminate the gap between the real demands of hospitals and patients and the industry. So we connect both the industry and also the real demands of the hospitals and patients as well. And what Lab Saúde can offer you? Well, it can offer you a faster and more effective response from agents who provide innovative solutions. And lastly, what are the results? What we aim to do? Well, we want to provide better health services and improve the quality of life of the elderly population. And how? By focusing on the demographic characteristics of Galicia, thinking as the European Commission recognized us as 4 stars reference site on the AIP or NAHA network. And I think, and we really think that Galicia can be a good opportunity for companies to test their innovative solutions as regards to the elderly population. So thank you very much, and we are open for questions.
Thank you, José María. If you have any specific questions on this pilot action, please do send them through in Slido. For now, I don't see anything specific for you, but I would be interested, because for me, this is a very good example of how you take good practices that from different regions, put it together and really adapt it to your needs. But especially now when we need new solutions and new innovation in the health, what do you think about this kind of lab model in general? Would that be something that you would see as useful for others to test as well?
Well, yes, mainly we are focused on technologies, but we have to really think that, well, we are at the end, we are replicating the idea also of Interreg Europe, because what we want to share are and to connect the quadruple helix, thinking that there is the industry, there are the patients, and always focusing on them, on the patient and on the real demands of the hospitals, of the health professionals as well. So I think this Living Lab model should be spread in all Europe. I know that there are some European initiatives, such as the ENOL and also the EIT Health, that they are taking the idea of the Living Lab model, especially now during the COVID-19 crisis. So I think it's a good opportunity that other regions can implement this model as well.